women and drug abuse. Rita, sorry, did you have a chance to watch it, and what are your thoughts?
Yes, well, thank you first for having us here. My name is Rita, as you said. I am a recovered drug user and currently a project officer working with the same community of people who use drugs. I did get a chance to watch it, and I personally, first, let me say I know a few of those people from a while back, and I've seen the project come up, and I think it's one of the very novel initiatives that have managed to get women to come for services, which has been a problem for us all along. We've got, when you talk about drug use, drug abuse, the image you see is of men, and you don't see women coming out. So having innovative approaches like that to the issue of women and substance abuse is really good. I was happy to see them actually being able to come out of their own self-stigma and speak. So I think it was a really good feature, and there's a lot to be learned from the conversations that were had in there.
Okay.
Yeah.
Esther, what were your thoughts?
Thank you for having us.
And Esther, you run a rehabilitation center.
Yes, I run a rehabilitation center, the Nueva Esperanza Treatment and Rehabilitation Center. I'm the clinical director. I've worked with women over the past years who use drugs. And for me, the feature was quite progressive, and it's really a nice way to give women dignity. We know a lot of time that they are shamed and they are not seen as who they are. They are introduced as drug users rather than human beings and people who want to aspire to do better things in the society. And it's really nice to see them doing things for themselves and also contributing to the economy of the country.
Okay.
Yeah.
So Rita, you say recovered drug addict.
Yes.
Isn't it usually recovering?
Yes, Olive, it is usually. But, and even before I came on, I thought about it, let's say recovering or recovered, but I've decided to claim it. Because, yes, programmatically we'll say recovering, and I always have to be aware of my triggers. As you say, once you have tasted addiction, then it becomes something that your brain is used to, and you have to be aware. But my saying recovered is just a way of claiming that I'm socially reintegrated, and the things that we're trying to do for the rest of the people still addicted, then that is why I use the word recovered.
Okay.
Yes.
All right, I look at you and you don't look like you are a recovering drug addict. Your transformation is amazing. Could you tell us a little bit about your experience with drugs? Okay.
Well, once you say that, and it's good that she's sitting here next to me because she's a big part of my recovery. My experience with drugs was it's straightforward. I was in campus. I finished high school. So out of high school, I want to have fun. I felt like I came from a very restricted high school that I wasn't able to really have fun. So I wanted to have fun. So I wanted to try things. I started by trying the easiest thing at the time, which was cannabis. Then I didn't know I had underlying mental issues at the time, but then it became easy for me to try heroin. So I tried it the first time, and it's always about trying when you're a young person.
And how were you exposed to
How was I exposed? It is. Well, while it's not as easily available as say alcohol and cannabis, you can find it. If you walk Nairobi, you can find it. So I just got it the first time and I tried it.
So were you with friends?
Yes, I was with friends. As I said, I was in campus. So I was with friends, and one of them came with it. So when they came with it, we said, let's try. So upon trying, and trying the next day and trying the next day, before you know it, you're hooked. Before you keep telling yourself, I'll stop next week, I'll stop next week. In about a month, I realized, okay, this stopping thing is going to be a bit difficult, and now I'm in it all the way. And it became now a need, a compulsive need that every day I have to have it, and if I don't, I will feel physically sick. So that is how I started. And then school became an issue because I couldn't concentrate. When I would get withdrawals, I wouldn't be able to concentrate in class. So I stopped going to school at that point.
What were you studying?
I was studying law. So that became a bit difficult to do at that point. Then I went on using, because now it becomes a habit. And the person I was with at the time, I was in a relationship at the time, and the person was also using. So we used for a number of years. And I can say I was lucky because it's usually it's difficult to quit a heroin addiction. It is difficult because of the levels of withdrawals. It's actually the most addictive substance according to most people. But in 2014, after a lot of push from civil society, an opioid substitution program called methadone came to Kenya, came to Nairobi, and came to Mathare. And luckily, I was in Nairobi, so I took myself to Mathare. Didn't tell anybody because, you know, the stigma, Mathare Hospital, yes. The stigma around just saying the word Mathare Hospital. So I took myself there, and I was on treatment there from 2015 to 2017, outpatient. But nobody found out until 2017, when it became now an issue at home, and they had to find out, and they had to come and at least know what was happening. So I can say I was lucky that the program came when it did, but and after that I was able to go back to school. Again, luck that I had the opportunities to go back to, and here I am now. Now I'm a project officer. I work with
is it Vocal?
Vocal Kenya, yes. The work we do is advocacy for drug policy reform, but a lot of my work is at the grassroots level because that's where everything begins. Yes.
Okay. So you say it was curiosity at first.
Yes.
But you had been using, you said cannabis
yes.
and alcohol.
And alcohol, yes.
So this was an escalation.
Yes, it was an escalation.
Okay. So what was it about that high that kept you going even after that first time?
About the heroin high. And again, goes to why it's considered the most addictive substance. It's very, and you know, for lack of a better word, it's a very nice high. It's a very strong high. You feel a high that is incomparable to maybe what you were using before, cannabis or that.
Were you able to function on that high?
For a while, yes. For a while, yes, you're able to function until the point where it becomes an addiction. Now, it becomes you can't focus on
like you
other
said, it becomes
responsibilities.
a need.
Yes.
So how did that affect your relationships in terms of how were you able to finance your habit?
Yes. Good question. In the beginning, I was using my family's finances because they thought I was going to school, but at that time I wasn't going to school. So I would use those funds and channel them into maybe whatever illegal business I could do at the time to be able to fund that habit. And this is where the intersection between drugs and crime comes in. You find yourself doing things considered crimes, petty crimes, small stealing here and there. Like a small pickpocketing.
You'd pickpocket people?
Well, I watched as people did.
Okay.
Yes, I would say I watched as people did because I needed that system to function for me to get what I needed to feel okay. So things like those. So a lot of women will also turn to sex work because it's easier than running around doing petty crime. That's once the finances run out. Once you're done. Once your family is done supporting you, once people have figured out that this money is going to your drug habit, then you end up starting to do anything that will bring you money. Yes.
So who was your supplier? Because something that actually, what you talk about, the sex work came up in that particular feature.
Yes,
and also and I'm coming to you, Esther, don't worry. I just want to finish it with Rita
no, it's all right,
first so that we have a case study. So sex work came up. Who was your supplier? Because something else that came up is that you find that 7 out of 10 women who are addicted were introduced to drugs by their lovers. And you say you're in a relationship where the person where your partner was also using. Did you enable each other?
Yes. Initially, of course, it began as trial for both of us. But yes, it becomes a situation where you enable each other because now you're both addicted. And you asked who was the supplier of the substance.
Yes.
Of course, there's the suppliers. There's the person who sells it to you.
And was that within your campus?
No, it was not within school.
Okay.
I don't think I don't think we have gotten to that level yet of hard drugs being sold within the school. And if we have, I haven't heard of it yet.
Okay.
So the suppliers are outside. So you go where you would go to get your cannabis, probably somewhere close by. You'll get the person with heroin.
So are these shopping centers, where are these places?
Really anywhere, not shopping centers, because you wouldn't expect to find cannabis at your local shop. So, well, they know where they sell, put it that way. They know where they sell to who they sell. It's a system. It's a very organized system.
Okay.
Yes.
So
it might be here today, it might be on this street today, and tomorrow it's not.
Oh, okay.
That's what I mean.
So it's a system of sort of referral, like the person perhaps who introduced you to the drugs referred you to their supplier.
Yes, trust and referral.
Okay.
Yes.
All right. And in terms, how much were you spending a day on your habit?
How much was I spending a day? By the time I was going to Mathare Hospital, I was spending about 2,500, or 2,500 a day.
So what amount of heroin is that?
That is about I don't know the grammage. However, that's about how many rolls?
Rolls, in terms of rolls.
20. That's about
also it's
20.
measured in rolls.
Yes.
Okay, so
it depends on the packaging.
okay.
Yes.
All right.
Yeah.
So in the feature we aired on Monday, there's a woman who talked about how she would need 5 or 6 sachets a day, and then one sachet is 200 shillings.
Yes.
She said it's about 200 shillings, and then she said you would needing 5 or 6. Sometimes you need to sleep with that many men to finance that habit. Is there a correlation between, like she's raised it as well, Rita has raised it as well, between drug abuse where women are concerned and sexual, even assault?
Yes, there is, and you will find that perpetrators of sexual violence usually look for people who have no power. And in this case, women who use drugs are people who are violated and they are suppressed, and they become an easier target for perpetrators of sexual violence, because the men will use them to with drugs so that they are able to sleep with them, and in that way then women become infected and they become hooked, and it becomes a vicious circle where they have to depend on this man to support their habit of addiction. Yeah.
So for women, there are many more pitfalls and many avenues through which they could get infected, either because the lady who spoke in that particular feature talked about having contracted HIV and hepatitis.
Yes. For women, it's a double tragedy, because through use of drugs alone, because of the drug paraphernalias that they use, they are likely to acquire HIV and hepatitis. And at the same time, because of sexual intercourse, they may also acquire HIV because of not having safe sex and lack of safe injecting practices. Yes.
And is it a case of them just being high and not taking those precautions, or just having no choice in the matter?
It's both, because when you're high, then you may not have the will to say yes or no. You're not in yourself. And at the same time, because of the withdrawal symptoms that she talked about, then you really need this substance, and it doesn't matter how it comes to you. So you'll do anything that you can do at that time to acquire the drugs to satisfy your habit. Yeah.
Okay, I want to come back to you with a question, but first I want to know from Rita, did your family know? Okay, know your friends, you were in the same circle, but did your family know that you were using drugs?
No, they did not know. They thought I was in school at first, and when they saw symptoms, one, they were not able to recognize what is heroin withdrawal. Every time I would try to quit on my own, that is maybe stay for a week and tell myself this week I'm just going to stay and detox and get all the shakes until it's over. 3 days into the week, they are worried. They're like, oh, the child has malaria. What are we going to do? So they didn't know. They knew there was a problem, but they didn't know there was a substance abuse problem, and they were not willing to accept it. Like I said, I was studying law, so for my mother, it was no, there is no way then my daughter can be using this. Eventually, they had to find out, and this was through the help of people like Esther. In fact, she was the one who referred me to Madare Hospital. The facility she was at is the one that referred me to Madare Hospital. And eventually, through them, I was able to now inform my parents just gently that look, it's heroin, it's not actually a cigarette or whatever it is you're thinking. And with the help of the doctors and the staff, they were able to understand. But it's not always the case. Like I keep saying, I am one of the lucky ones. Yes.
All right, so they finally reached the point of acceptance.
They finally reached the point of acceptance, though it is still a process. Even every time I do something public, even my being here, my mom, I had to tell her, I had to inform her in advance and prepare her for what we'd be talking about.
Understandably.
Yes.
Understandably, yeah.
Yes, so it's still a process, but eventually, yes. And for many other people in addiction as well, the family has come to know through these other services that are offered.
Okay.
Yeah.
Esther.
Yes.
How do family members, how do friends who are not part of that drug abuse circle, first of all, how do you identify the symptoms? And then how do you manage the person?
That's a good question, and you'll find that we are social beings and we are living with our families. And a lot of time when people start using drugs, what they do is to withdraw from their loved ones, is to withdraw from their families. And sometimes it may not be very obvious for the family members to know that this person is using drugs. You see a case of heroin. What Rita is talking about, it's not something that you'll be intoxicated like somebody who is taking alcohol, so it may be hard. For alcohol, it may be difficult to hide. But family members, once they realize what they do sometimes is what she's saying, they're in denial, and they're thinking it's a phase, and they prolong the matter. And sometimes they may do things that they think they are positive, that they are pushing, but they are pushing this person more into addiction.
Okay,
so
like what?
like just moving them like from this town to the other town, thinking maybe this town is where they are getting these influences, and they take them to another town. And if you're a person who is using drugs, when you go to the other town, you still find a way to find those drugs and to fuel your habit. So what families should do is just to come out and go to centers where there is help and start the help early, because the more we wait, the more that this person is getting into addiction. But eventually addiction is a disease that people can recover from. As much as we say it's chronic and it's a relapsing brain disorder, it's something that people can recover from, but it needs to be treated in a way that people are recognizing the standards that are laid by the government, so that the person can get the help that they need.
Okay.
Yeah.
There's something she talked about. She talked about methadone treatment.
Yes.
What is methadone treatment?
Methadone treatment is a substitute therapy for people who are using heroin. You'll find the substances that are used, like heroin now, we have something that we call the substitute therapy, where they can go to get an alternative that will cater for the withdrawal symptoms, and they are able to live safe and cater for the highs that it's a safe treatment that will help them to recover their lives. Yes.
Okay, so how long should a person be on methadone treatment? Is it lifelong?
That's a question that is debatable, but a person, the prescription for one person is not the prescription for the other person, because methadone alone is not enough. There are also other therapy issues that somebody is taken care of, and where they were when they were joining methadone and how they will progress with their life. There are people who are in methadone for a shorter time, and there are people who are methadone for a longer time. So it is dependent with the person and how they are adhering even to their methadone therapy and their psychotherapy, and also the social reintegration program. They are able to progress and do other things. The good thing with methadone is that you take it you go to the clinic in the morning, you get your dose.
So it's administered?
It is administered, it's controlled, and lucky enough that we have our country that is supplying methadone, and it's free. You see heroin, they use so much money to buy it, but methadone is free and it's safe. Once you use it, then you start regaining your health, you start regaining all your functions, and you're able now to become productive in the society. What also they do in methadone is to help you too with social reintegration. We're connecting back to your families. If you're in school with Rita, then they help you, advise you on how to go back to school, and you're able to regain your functions and continue taking methadone as you continue doing your work. Addiction, as I said, is chronic. It can be lifelong, and you need to be in a program for a longer time so that the benefits are good for you.
Okay.
Yeah.
So, okay, you know, alcoholics have Alcoholics Anonymous, and drug abusers have, is it Narcotics
Anonymous? Yeah.
So are you meant to be part of that? Is it advisable that you're part of that support system for the rest of your life?
Yes, therapeutic communities are very important, because as much as there's peer-to-peer interactions, where people who have just joined a program will be mentored by people who have been in a program for longer, like what now Rita is doing, is mentoring people who are recovering now, just to show them that it is possible, talking to them, telling them what is possible, and how to avoid some of the triggers and some of the things that they may take them back, and just also channeling them to things that are more productive, because once you're used to using drugs, you have some sort of friends. Now you have to make new friends, you have to find new places to go, you have to find new things to do, which is not always easy. And this is where even the family support comes in, so that they can help people to move on and forge in a new life.
Okay.
Yeah.
Rita, do you have a sponsor? Is that how it works?
No, it doesn't work quite like Narcotics Anonymous and Alcoholics Anonymous. Because this is, for methadone is harm reduction, while the approach for Alcoholics Anonymous and for Narcotics Anonymous will be to tell you to abstain. For harm reduction, nobody is going to tell you to stop. Nobody is going to be your sponsor, but they will teach you how to use safely, how to reduce the harms that are associated with your use, and you yourself, with time, will decide to stop on your own. So I didn't have a sponsor. I did have very good doctors, though, at the centers and at the hospital. And I had a very good psychotherapist. I had a good psychologist. So those are my sponsors, the health staff that were there.
Okay.
Yes, that's how it works.
Are there people, Esther, who are more predisposed to addiction than others?
Yes, because we see addiction has the biological functions. You know, like if you have a family, if there's a history of family use in your family, you are likely also to get into that. There's the issue of the environment where we are growing up. Are you interacting more like the children who maybe their parents are drug users? The early exposure is something that can also expose them to drug use. Also, your social interactions and peer pressure and those things that we talk about, they can predispose you to be more at risk of drug use than the others. And you always say prevention is the best. Once you have prevented our children, the people in the society from using drugs, is the best measure, other than waiting for somebody to get hooked up and go on. And you'll find out there are a lot of programs in schools, a lot of programs in the universities that are talking about drug-free. And for those who are already in drugs, the government have now what we are calling the harm reduction services, where somebody is already using, but we are telling them, use safely as much as we're trying to get them out of drugs. And then again, there are the treatment centers for those who have already been addicted, that they can go to get help. Both NACADA and the Ministry of Health have programs that are well tailored to help people who are drug users.
Okay.
Yeah.
Both of you have made reference to triggers. What are triggers? Rita?
What are triggers? Okay, triggers for me, so let me just give you one personal example. Triggers for me would be being around somebody who's using heroin constantly, being around, drinking a lot of alcohol, anything that reminds me of the high that I felt, that reminds my brain of that high, then might get me thinking of that again. Might also be the friends I kept at that time. And I like that she's mentioned that you have to find a new circle of friends. And sometimes you and your circle of friends have to find a new circle of friends together. And you have to change the places that you used to frequent. I might have friends in that area, but I have to not go there. Know my triggers, sort of know what, if anger management was a problem that led to perhaps my increased substance use, then I have to deal with that first. If I had family issues, then once I'm in recovery, if I go back to those same family issues, that will be a trigger for me to go back. So it's really just awareness of yourself and what led you there and what led you out and what you're living for, really.
Okay, speaking of what led you out, what pushed you to seek help?
What pushed me to seek help? And like I said, I'm lucky because I had a bit of information about heroin, about drugs, and again, I had the right support at the right time. I had people who approached me in a non-judgmental way. I was not judged, and because of that, I started to think about it. I don't think anybody in addiction is happy to be addicted. It's just that you have no way out. You have no way of fighting against what is your brain's impulse to get out.
So, is it a disease?
Yes. Yes. Officially, yes. The WHO will tell you that it's dependence now. It's not called addiction. But, you know, those semantics aside, it's a brain disorder. It is a disorder. It is not how things should be. So what pushed me was that, the support, and also just the strictness of my mother came in at the end and just told me, you know what, this is not what your life should be. This is not what you want anyway. So I sought treatment. I didn't know if I was going to finish the treatment at the time, but you just, any way out. It was any way out of what you're feeling at the time.
So is it a day at a time?
It is definitely a day at a time, because there's reuse. You might, during your treatment, you might reuse, we call it relapsing, reusing. The behavioral issues that she's talking about, the therapy has got to be holistic. So it is definitely a day at a time, and that's really all we can do. That's why we say family and friends have to support. You can't judge, because you can't begin to understand what's going through that person's brain. So start by reading the science behind it, equip yourself with knowledge, and it's out there. Then support the person, and they will want to come out. Give them a reason to want to come out.
Okay.
Yes.
And that, two final questions for you, really quickly. One, she talks about her mom being very strict with her towards the end. What can families do so that you don't push this person further away, because you talked about them withdrawing?
Yes.
And then secondly, if I need help, where do I go?
What families can do is what we call tough love. And sticking to this person through thick and thin. You just can't abandon this person, because as she's saying, addiction is a disease. Now we have put it under the mental health issues, and I'm happy that the mental health task force is looking into it deeply, so that we could understand addiction is not something that a person is pretending, or it's a phase. It's a problem like any other.
They need help to get out of it.
They need problem
and
health
treatment.
And treatment, just like the way somebody has malaria, we rush them to the hospital, or hypertension. Even addiction is a disease, and it's treatable, and we need to look at it as that, so that we can help this person the way they should be helped. Yes.
So this whole idea of why can't they just stop, it's a choice, is not the reality.
It is not the reality. Once you start because voluntarily. But once you start using drugs, then it becomes compulsive and you're not able to stop by your own. It hijacks your brain, and your brain now only wants to seek that drug. The drug is what is giving you pleasure. Any other thing doesn't matter to you in your life.
Okay.
Yeah.
So really quickly, finally, if I need help, where do I go? Where do I go?
There are many centers that you can go for help, and as I said, NACADA and the Ministry of Health have approved centers. If you go to the NACADA website, you'll find all the listed rehabs that you can visit to. In the case of heroin, we have the methadone centers that are government-sponsored. Here in Nairobi, we have centers in Mathare and in Gara. We have one at Kiambu County, and we have other centers at the coast where people can go and seek help. As I said, anywhere you go, even in government hospitals, when you go, people are trained on addiction, they will go and refer you to the right places. It's a specialized way of treatment, and there are people who are trained to cater for that.
Okay.
Yeah.
It's a conversation, I think, which could take us the whole morning. You look like you have one final thing to say.
Yes. I'll say this for recovery, that more definitely needs to be done. For example, I might be done with the treatment option, but when I leave there, I might have a criminal record because maybe I was arrested for cannabis possession. So as much as a lot of this has been pushed by civil society to have these services available. But if we could have the three arms of government that deal with these things working together: health, security, and social services, for an approach to addiction that really looks at the person, looks at it as a health issue and not as a crime, then recovery would work. Otherwise, we'll just keep going round in circles. And I look forward to having more of these conversations.
I know, we didn't even scratch the surface as far as what more needs to be done is concerned, and children who find themselves in homes where drugs are being abused. Well, that's it for AM Live Plus. I'll see you again at